There are only 3 doctors left after international organizations evacuated their staff because of nearby fighting. One of those evacuated was Dr. Seema Jalani of the International Rescue Committee.
That feels very close. There is no morphine left. I've always told myself there's not much we can do in medicine, but we can treat pain. And it's no longer true anymore, so we cannot even offer any comfort here. There is no death with dignity when you're lying on the ground of an emergency room in Gaza.
And Dr. Seema Jalani now joins me from New York. Dr. Jalani, thank you so much. We just heard you say no death with dignity. What had you seen that made you say that?
In my first 3 hours of working at Al-Aqsa Hospital, I treated a 1-year-old boy with a bloody diaper, and his right arm and right leg had been blown off. There was no leg below the diaper. He was bleeding into his chest. I treated him on the ground because there were no stretchers and no beds available. And when the orthopedic surgeon came to wrap his stumps up to stop the bleeding, I would have imagined in the US this would have been a straightforward case that went immediately to the operating room because of the severity as a stat case. And instead, the impossible choices inflicted on the doctors of Gaza have made it such that he wasn't the emergency of the day. There was a waiting list, and the operating room was already full with other more pressing cases. And so I asked myself, what's more pressing than a 1-year-old without an arm, a leg, and who's bleeding into his chest and choking on his blood? And that will tell you a little bit about the scale of devastation that the people of Gaza are suffering.
You're a pediatrician. What does it say that your expertise is needed at this moment in Gaza?
I've worked in war zones for several years, if not decades, and I shouldn't be useful in a war zone because I would expect that the injured and war wounded would be young men. Instead, I'm disturbed to tell you that I was extremely useful in Gaza. At one point, we were resuscitating 5 patients from the brink of death in the code room, and 4 of them were children under the age of 15. That shouldn't be the case in the war. I shouldn't be useful as a pediatrician.
What moment, which patient will you most remember?
There was an 11-year-old child who was brought in, and she was burnt so much that her face was charred and black. Her arms were flexed and immobile, and we did not have any information or contact information for parents, whether they were alive or dead. The emergency room was permeated with the smell of burnt flesh. And I just kept thinking that this is one of so many of a generation of orphans that are going to be born into Gaza, burnt and amputated and with no life to speak of, no access to services, no family members, and it will stay with me for all my days.
While you were there, another of your audio recordings, you questioned whether you were making a difference. Looking back, do you think that your time in Gaza made a difference?
I do. I do think we were there to support the healthcare staff who's on the brink of collapse. The doctors were showing up, having been forcibly evacuated already, not once, not twice, but somewhere 4 to 5 times. So they're scavenging for food and water and shelter for their families and showing up the next day in scrubs and with a stethoscope in hand and valiantly, bravely seeing patients. And one day there was a gentleman quietly sobbing in the doctor's area, and we asked what had happened. He pronounced a colleague dead overnight. And I said, should we leave? And he said, no, please stay and just see the patients today. I can't face them. And so I do think that us being there shows a solidarity and a support of the Palestinian staff, and they need a break, which we need a sustained ceasefire for this to be able to occur, for services to be able to be provided to people. We also saw many, many patients to try and empty the emergency room. The emergency rooms and hospitals have become de facto shelters, so try to continue to increase patient flow. And at the end of the day, it's the intangible. It's holding hands with a dying patient. It's holding the mother whose legs give out when you tell her that she has to bury her child. That's what we're there for, to serve people that are suffering.
You're back in the U.S., you're in New York. What do you want world leaders to know, whether in New York or Washington, D.C.?
World leaders need to acknowledge the scale, magnitude, and severity of the human suffering that is happening on the ground. We cannot look away anymore, and there needs to be a sustained ceasefire in order for us to be able to provide basic human services and dignity to the people of Gaza. And they have a voice and they have power to make that happen.
Israel says Hamas uses hospitals as cover for tunnels. Did you see any evidence of any kind of militant activity in or around the hospital?
I did not see any evidence to suggest that, and the IRC would never work in a hospital that would be used for those purposes and condones any violation of international humanitarian law.